growing up, my dad was always I would say somebody I look up to. I really wanted to be like my dad, but he was a professor, but he had it's like an it wasn't a blood aunt, but it was a family member who was a pharmacist. And growing up, I always admired her. So not knowing much about pharmacy, I thought, okay, I want to be like that auntie, right? My dad wanted me to be a medical doctor, but anyway, I decided I wanted to be a pharmacist. But as I grew up and I learned a little more about the pharmacies, I really liked it because I felt that, okay, we are privileged to know so much about treatment modalities. And people are sick, people are suffering. I've always had that compassion for people who are suffering. When somebody is suffering, it's like God made me. I want to be able to be the channel that God can use to make a difference in that person, even as a young person, not really knowing medications or any of the health approaches to life. But then I'm so glad that I chose the pharmacy profession. And of course, I know a lot of medications. And yes, the doctors prescribe the medications we recommend, but then I can help people to be able to better take their medications, how to take it in order not to get so many problems. But also, like I said, as much as I'm a pharmacy doctor, I'm more into the holistic. And holistic was saying that it's not just putting a bandage, like you said, medications are like a bandage. You sick, blood pressure, you just put it. No, but we care about the spirit. The person is whole, spirit, soul, and body. So when again, something that prayer is part of medicine, again, maybe swimming, eating the ginger, eating the turmeric, all of those things are very, very healthy to overall like health. So again, knowledge, I went to school for that, right? And even after I graduated as a college professor, I'm somebody who I'm always learning. And because I'm somebody who sees that medications are poisons, so that's why I believe I delve into the holistic. And growing up in Cameroon, I remember when I used to spend some time with my grandmother when somebody got sick. Of course, like I said, hospitals were actually perceived as a place where people go to die. So fever grass, which is lemongrass, that with COVID, many people, lemongrass became like a big deal. That's something that growing up as a little girl or as in college, when somebody got sick, fever or so, they will put that grass in hot water and put it in a bucket and cover you with a blanket, and then you sweat out whatever is causing the fever, and then you feel better. You take a bath, then they give you hot soup, you drink, you're good to go. Somebody has a wound, the grandma goes out there, gets some herb, squeezes it and puts there, so you feel better with no side effects. So now when I started teaching after some years, and reading and fact, so there was like, okay, a resurgence of the holistic approach to healthcare, not just focusing on the medication. So what are some of the lifestyle changes? What are some of the things? And if you look at the Asian community, what they eat, all different types of exercises to prevent, and also it also so happened that I was entrusted with developing the course for a complementary alternative and natural medicine. So I teach that course right now. And again, I practice a lot of the things that to me are not controversial to my belief or my religion, and I see a big difference. So I encourage that, and I try to be an advocate for that to help others to also embrace it, and we're seeing a lot of difference. I do a lot of health fairs, like I said, I do a lot of health awareness, both nationally, locally, nationally, and intercontinentally. I traveled to Romania during the COVID. I go to Africa. I've been to so many countries, and I enjoy doing that because I just believe that we're not limited, to just where we are, like some of us where we work, right? So even at the church, I'm part of a very great church, and in the church also, I work with the other healthcare professionals. So we do so many programs, to be able to help our people to better take care of themselves physically, mentally, right? We have God, but God wants us to take care of ourselves. So we do that a lot, and it's making a difference. So such that we can really share a lot of these things that can make a difference in your life, and because we care about you, and we want everybody to see themselves as valuable, and because you're valuable, your health is all you have, right? Take care of your health. Health is wealth. and you can make a difference. Trust me. It doesn't matter where you are right now. It doesn't matter what diagnosis that the medical doctor has given to you. There is a God that can heal you supernaturally, but He's also giving you different strategies that if you apply them, you might not get, the results right away. You might not see like the difference right away, but as you continue to do it, trust me, over time, it's going to make a difference for you, for your family, and for others in your circle. It's worth it. Let's be each other's keeper and let's make a difference while we're alive. God bless you.